These videos have been developed for instructional purposes. For this reason, the nursing students and nursing instructor review the steps of the skills at the bedside. In actual nursing practice, you and your instructor should decide if this approach is appropriate for you.
Hi, Melissa.
Hi, Miss Scott. How are you doing today?
Fine, thank you. And how was your weekend?
I wish I could say fun. I spent most of it parked behind a stack of books, trying to get prepared for the day.
Well, it is your first day of clinical experience. Tell me, how are you feeling about that?
I'd be lying if I said I wasn't nervous.
Well, that's perfectly normal. Most of us are. Tell you what, come with me and let's go see the other nursing students, and we'll have a pre-conference before we hit the floor. Will that make you feel better?
Yeah, that would be great.
Okay, let's go. Okay.
So you look really tired, Mark.
Yeah, I am. You know how when you go out and you know
And
you
you
have a
don't
lot
do
of
your
work to
work.
do? Yeah, and you regret it the next morning?
Yeah, but we're
So
prepared.
then
I mean, we spent weeks
You're
preparing for
stuck
this.
with cramp.
You guys probably know each other. Melissa, this is Mark.
There you go, Melissa. Good morning. Nice
And
to
this
see you
is
again.
Katie.
Hi.
Hi.
So I thought we'd have a review before we hit the floor. You know, take some time to focus on the day's goals and, first of all, relax. Now, our primary objective today will be vital signs, so let's review some key points. We're going to start with temperature and pulse. So, Melissa, tell me, what's the most common way to take a temperature?
Oral, because it's the easiest to use.
Right. But you should avoid taking a patient's temperature orally if they had any type of nose or mouth surgery, or if they're suffering from diseases in the oral cavity. And you shouldn't take an oral temperature if the patient can't close their lips around the thermometer.
About how often and when should you take a patient's temperature?
Well, say that depends on their condition and the hospital policy. But you should always wait about, 15 minutes to a half an hour after the patient has eaten anything or had anything to drink, just to ensure that you get an accurate reading. Now, let's talk about measuring a patient's pulse. Oh, that's okay. What's the most common pulse site for both children and adults?
The radio pulse
That's right. And how are pulse rates measured?
in beats per minute. And you place your fingers, do you mind?
Oh, not at all. Go
You
ahead.
place your fingers over the artery like this, so that the fingers are flat against the skin.
Very good. Just be sure not to just press with the fingertips. And remember, you can use the same technique for other peripheral pulses, too. Melissa, how about respiratory rate, and how is that measured?
By counting the number of breaths per minute.
That's right, and you should also watch the depth and the rhythm of the breathing. Plus, it's always a good idea to move right from the pulse measurement to counting the respiratory rate so the patient isn't aware that you're counting their breaths.
Is that because a patient may change their breathing habits if they know they're being monitored?
Exactly, and that might cause the measurement to be inaccurate. So let's get started. Mark, why don't you and Katie go meet your patients, and I'll trail Melissa for a while and catch up with you a bit.
Sounds
Okay?
good.
Great. Thank you.
Have fun. Relax.
All
Yeah.
right.
So my patient has been running a bit of a temperature for the last few days due to a wound infection. The nurses have been checking her vitals, blood pressure, temp, pulse, respiration every 4 hours, and it's about time for another reading.
Good. Do you have the right equipment?
Well, let's see. In order to check her vitals, I'm going to need my electronic thermometer and probe covers, blood pressure cuff,
Very good.
a watch, and a stethoscope. So yeah, I think I'm all set.
I think so, too.
Good morning, Mrs. Lewis. I'm Melissa King. I'm a nursing student, and this is my instructor, Miss Scott.
Mrs. Lewis.
How are you feeling today?
Well, not bad. I'm just feeling a little clammy, though.
Yeah, okay, well, we'll see if that fever's broken. We're going to be taking your temperature, pulse, and blood pressure. Is that okay with you?
fine with me.
Okay. I'm going to close the door to give it some privacy.
Okay.
A little hand hygiene. Right. So I'm going to check your ID bracelet real quick. Okay.
Good. So the first thing you're going to do is check Mrs. Lewis's chart just to see how often the temperature, pulse, and respirations are taken.
All right.
Good.
It says here they should be at 4-hour intervals.
Okay. Oh, so that's round about now. Okay. Now, sometimes nurses make the decision to check the vital signs more frequently. It depends on the patient's condition.
Okay.
Okay.
Well, should I wear gloves?
Oh, now, see, that's a very good question, Melissa. You need to wear gloves when there's a possibility of coming in contact with blood or bodily fluids, or if the patient has excessive secretions coming from the mouth, or if contact precautions are being observed. But in Mrs. Lewis's case, gloves aren't necessary.
So I'll just check the thermometer, make sure that it's working properly.
Good, good.
I take it out of its pocket.
Good.
I put it in the probe covers till it snaps. And then I place the thermometer under Mrs. Lewis's tongue in the posterior sublingual pocket.
Very good, yes.
Okay, Miss Lewis, if you don't mind me, just, raise your tongue a little bit. How's that? All right, close down on it. Okay. I'll wait a couple seconds. Okay, all done. You can open up now.
Good. Now be sure to dispose your probe cover, and then you'll want to record your reading on Mrs. Lewis's chart.
Right.
Okay.
So it's 97.3.
Good. 97.3, Mrs. Lewis. Very good.
So we're going to move on to pulse now, if you don't mind.
Fine.
You can take your wrist here, and with my first, second, and third fingers, place it on the radial artery, and then with my thumb against the back of the wrist, up against the radius
That's
bone,
right.
just enough pressure to feel the pulse in the artery. Then with my watch, I'm going to count the number of pulsations within a 30-second period,
That's right.
noting the rhythm and the strength of the pulsations.
Right. Then you multiply the number of pulsations times 2 to get the per minute pulse rate. However, if the pulse is abnormal in any way, you'll want to count for a minute. Okay? All right, let's get started.
Okay. Very good.
Very good, Melissa. I noticed you went right from counting the pulse to observing the rise and the fall of her chest. You remembered. And there again, you count for 30 seconds and multiply by 2 to determine breaths per minute. And if her respirations are abnormal in any way, you want to take them for the full minute. You have to remember that. That's very important. You want to chart that down.
There it is.
Very good. Good. Okay.
Okay, Mrs. Lewis, now we're going to move on to blood pressure.
All right.
Now, we take a patient's blood pressure only after they've rested for at least 5 minutes. And you also want to make sure that the patient hasn't smoked or had any caffeine for at least 30 minutes.
Mrs. Lewis, have you had any cigarettes or coffee in the last half hour?
No, just a little juice and some oatmeal.
Oh, good, good. Now, in this case, we can measure using either arm. If there were a dialysis catheter or any venous access devices like a PICC line or an implantable port or an intravenous access, we have to use another limb.
Okay, I read that you shouldn't take blood pressure where there's a surgical site or on the same side as a mastectomy.
That's right, that's right.
Okay, so I'm going to clean my stethoscope with the alcohol swabs and we can begin soon.
Okay, and while you're doing that, I'm going to help Miss Lewis get comfortable. Okay, good. There.
Okay, Miss Lewis. So I'm going to take your arm, raise it at heart level, palm up so I can locate the brachial artery. I'm going to undo this for a minute so I can expose your upper arm here. And then with my first, second, third finger, palpate to find brachial pulse.
Yes.
It's right there.
Okay, you
All
got
right,
it?
yeah. Now, blood pressure cuff.
Okay,
I'll
now line it
line up
up
the-
right.
yeah,
Yes,
line up
make
the
sure
bladder
it's
right.
lined up. Good.
The artery.
Good. Good. The lower edge of the cuff should be about 1 or 2 inches above the inner aspect of the elbow, and the tubing should extend from the edge of the cuff near the patient's elbow.
Right.
Now, tell me, what's your next step?
Okay, well, I'll check to make sure the cuff is snug around the upper arm. Then I'll look and see that the gauge is at 0. I'm going to estimate her systolic pressure first. So I'll find the brachial or radial pulse and then tighten the screw valve on the bulb.
Okay, right. Now, use the bulb to inflate the cuff as you palpate the artery.
Okay.
All right, now take note of the reading when you can't feel the pulse anymore. This is the estimate of her systolic pressure.
Yeah, I couldn't feel it after 128.
Oh, okay, good. Now deflate the cuff and wait about 15 seconds. Okay, good. Now palpate the brachial pulse and place the bell or the diaphragm of the stethoscope firmly over the artery. Now make sure that it's not touching the cuff or her gown.
Okay.
Just like that. Good. Now you can go ahead and inflate to about 30 millimeters above where the pulse disappeared when you palpate it. Okay, wonderful. Now slowly open the valve on the bulb and let the air out about 2 to 3 millimeters of pressure per heartbeat. When you hear the first sound, that's your systolic pressure.
I hear it.
Good. Keep deflating until the sound becomes muffled. And then continue to deflate until the sound disappears. Now, you might hear them together or separately, but once the sound disappears, that's the point of a diastolic pressure.
It's gone.
Okay, what did you get?
126/68?
Good. Now, let's go ahead and completely deflate the cuff, and be sure to document your measurements according to the policy. Now, you do know how it should appear on the chart, don't you? Okay.
It should read 126/68.
Good, yes, yeah.
126/68.
Now, if you've taken a blood pressure other than the brachial site, be sure you mark on the chart exactly what site you use.
Okay.
All right? And be sure to report any abnormal findings to the patient's primary care provider.
Mrs. Little? So this is Mrs. Little. She's recovering from her surgery this morning. The nurses have her on an automatic electronic machine to monitor her blood pressure. Now, do you usually use automatic machines after surgery?
Well, it's often used in acute care settings, like during anesthesia, post-op, or anytime frequent assessment of blood pressure is necessary.
Okay.
Now, the unit is set to monitor the patient's blood pressure at preset intervals.
Well, how does it work?
Well, pretty much the same as any oscillatory device. The cuff is applied in the same way with the microphone or the pressure sensor positioned directly over the artery. Okay. And how it works, it determines blood pressure by analyzing the sounds of the blood flow through the artery or by measuring oscillations.
That's pretty cool.
Yes, it is. Yes. See, when using something like this, you have to keep in mind that irregular heart rates, room noise, or even excessive movement of the patient can interfere with the readings. And you also need to make sure that the cuff is completely deflated after the readings.
Now, why is that?
Because if it doesn't deflate all the way, it can cause inadequate arterial perfusion and venous drainage, which can compromise circulation in the limb.
I know it's our first day, but I'm really excited to get on the floor. I mean, I'm very anxious to get some hands-on experience.
Oh, I'm so glad to hear that, Mark. It's good to be excited about learning.
So I'm going to need to take a tympanic temperature.
Well, so what can you tell me about a tympanic temperature measurement?
Well, you can use the tympanic route when taking an oral temperature becomes more difficult because it's quick, it's easy, and it's safe. So since my patient has a sore throat, tympanic is probably better.
Good. But you should avoid using a tympanic thermometer when there's excessive drainage coming from the ear or if there's scarring of the tympanic membrane because it can cause problems for the patient. And besides, you may not get an accurate reading.
So can you still use the tympanic route when the patient has an ear infection? Or if there's a lot of earwax? Is that going to affect the reading at all?
Oh, well, not significantly. You just have to make sure when you insert the probe into the ear canal, you insert it tightly enough to seal the opening. Or you can pull up on the pinna just a little bit. Just straighten out the ear canal and expose the tympanic membrane.
Like that?
Just like that. Yes. Okay?
Yeah, let's go.
And you're going to be handling the procedure. I'm just going to be there to walk you through
Okay.
it. All right?
Sounds good.
Okay.
All right.
You're going to do fine.
Hello. Hi, Mr. Shepard. My name is Mark Toludo. You can call me Mark. I'm a nursing student who will be caring for you today. And this is my nursing instructor, Miss Scott.
Mr. Shepard?
Hello.
Hi.
And how are you feeling today, sir?
My throat's still really sore.
Okay. All right. Well, we're just going to have to take your temperature and see how that fever's doing, all right?
All right.
Okay. You mind if I take a look at your ID bracelet?
No, go right ahead.
Thank you. Everett. Give me a moment while I clean my hands and put on a pair of gloves.
Good. I'm glad you remembered that because you're going to need to remove the probe after it's been in Mr. Shepard's ear. Very good, Mark.
Thank you.
You're welcome.
All right, Mr. Shepard. Now, this is a tympanic thermometer. I'm just going to put it on the inside of your ear for just a second, okay?
Okay.
Okay, now remember, Mark, gently insert the probe in the ear.
Could you please lift your right, Mr. Shepard?
Okay.
Thank you.
So it'll make a seal. There you go. Now angle it towards the jawline. Good. Press the button on the handle and wait for the reading.
98 degrees.
Very good. 98.
Looks like we got a hold of that fever. Looks like
Okay.
it's getting back to normal.
Now, what I need for you to do is make a note of it on his chart and also put the site down. Okay?
Yep.
There we are. And remember, any abnormal findings, report it to the patient's care provider. Okay?
Mm-hmm.
All right.
So now I have a patient who came in with an infection and dehydration, and the doctor has requested that we do a rectal temperature.
Rectal temperatures are thought to be one of the most accurate temperature measurements. However, you should try to avoid this site whenever it's possible because it can be very uncomfortable for the patient.
You think he's uncomfortable?
Okay, so you have everything?
Yeah, I think I have all the equipment I need right here.
Okay.
I have the electronic
Good.
rectal thermometer, the probe covers, the water-soluble lubricant,
Good.
the box of tissues, and gloves. I need a pair of
Oh,
gloves.
no, they're in the room.
Okay.
Okay.
All right. Mr. Jordan? Hi, my name is Mark Toludo. I am a nursing student, and this is my nursing instructor, Miss Scott.
Mr. Jordan?
We're just going to need to take your temperature rectally. It will only take a moment.
Oh, yeah, my doctor told me something about that.
Okay. Here you are, Mark.
Thank you.
You're welcome. So, let's check his ID.
All right.
Okay.
Okay, Jordan.
We're going to raise the bed a bit to get him a little more comfortable working height, all right?
Okay.
And then we're going to work together to move him on his side.
No problem.
Okay. All right.
Now I'm just going to move the sheet just enough to expose his buttocks.
Okay, let's lift this sheet right here and roll him to his side. We're going to roll you to your side, Mr. Jordan. You're doing fine. There you are.
Okay.
Okay. Now place the probe cover on the thermometer. Okay, and apply 1 inch of lubricant to the probe. That's it. Okay, Mr. Jordan, you're going to feel us touching you? Okay. It's going to be fine. Now, sphincter is clearly visible. And now you're going to insert the thermometer to 1.5 inches into the anus. And remember, for a child, it would be about 1 inch, okay?
Now I'm just going to wait for the beep.
That's right. Okay, you can remove it now. Gently, gently. Okay. There, now get your tissue.
Going to use a tissue to remove any excess lubricant or feces from
Exactly.
the anus.
There we go. Are you all right, Mr. Jordan? Yes. Okay, we're about finished. Okay, all done, Mr. Jordan. Now. Okay.
All right.
Okay, we're going to roll you back now, Mr. Jordan. Be sure to enter the reading on his chart. Okay, there. And we're going to pull your bed back up, okay? There you are.
Here we go.
Okay. Thank you, Mr. Jordan.
Thank you.
Thank you, Mr. Jordan.
Thank you.
Have a good day.
You too.
Thank you. Thanks.
And I think you did very well for the first time.
Thank you. Thank you very much. I was a little nervous.
Wow, that's only normal to be nervous. But,
I just experience.
but you had the patient comfortable, and that was important. And there you are. Mark, you and Melissa continue with your patients while I work with Katie, and I'll catch up with you later.
That sounds great.
Okay.
Thanks a lot, Miss Scott.
Bye.
See you later. Bye, Katie.
See ya.
Well, Katie, you ready for me to see your patients with you?
As ready as I'll ever be. What are we going to be focusing on today?
Well, I thought we'll start with axillary temperatures, even though it's the least reliable of all the sites. But sometimes we have to use a patient's axilla to get a temperature reading.
When would you measure an axillary temperature?
For the most part, you measure an axillary temp when the oral, rectal, and tympanic readings aren't possible. And in this case, your patient is on a number of IV medications that are making her throat and mouth sore and inflamed with ulcers.
So an oral temperature reading is just out of the question.
Right. And a tympanic thermometer might increase the pain she's been experiencing from her stomatitis.
What about a rectal temperature reading?
Well, normally that would be okay. But her white blood cell count has dropped to a dangerous level. So an axillary reading is the best choice.
Okay. Hello, Mrs. Stevens.
Oh,
Hi.
hello.
I'm Katie Roth. I'm a nursing student, and this is my instructor, Ms. Scott.
Mrs. Stevens, hi.
How you doing?
We're going to be taking your temperature today. If that be all right?
Yes.
Okay, great. I just need to take a look at your ID bracelet. Okay, thanks. I'll just pull the curtain a bit.
Miss Stevens, you look a little uncomfortable. Can I help you? Can I get you anything?
No, that's all right. Thank you.
All right.
Have you had your bath today, Mrs. Stevens?
Yes, I had it about an hour ago.
Good. It's very important that we wait about 15 to 30 minutes after a patient has had her armpit washed before taking an axillary temperature. Okay, so I'm just going to pull your gown back a bit here.
Okay, Katie. Now be sure you place a probe cover on the thermometer before you get your reading, okay?
Right.
Okay.
Okay, I'm just going to lift your arm up a bit.
Okay, good. Good
Great.
placement.
Okay, all done.
Okay.
Great. 99 degrees. Thank you.
Okay, 99 degrees, Miss Stevens. We hope you feel better. All right.
Thank you.
Now, Katie, I need for you to note the temperature and the site. Okay. And also remember, if you have any abnormal findings, you must report it to the patient's care provider.
Okay,
All right?
great. Thank you.
Thank you, Mrs. Stevens. Feel better.
Thank you.
Okay. Bye-bye.
Bye-bye.
The medication requires that the heart rate be at a certain level before administration, so I'll just need to take an apical pulse rate.
Oh, good, good. Apical pulse measurements are often used prior to giving certain medications, and when it's difficult to assess a peripheral pulse, or when the pulse is just extremely weak and rapid.
And we measure an apical pulse rate by listening at the apex of the heart.
Very good, Katie. Okay, now tell me something. How do you go about locating the site to get an apical pulse?
You place the diaphragm of the stethoscope between the 5th and 6th ribs at the left mid-clavicular line, and then you measure in beats per minute using a watch to count.
Okay, Miss Katie.
Mr. Allen? Hi. My name is Katie Roth, and this is Ms. Scott.
Hi, Mr. Allen.
I'm a nursing student, and Ms. Scott is my instructor. And we need to measure your pulse rate before we give you your medication. So may I take a look at your ID bracelet first? Great.
I'll take that for you.
Okay, terrific. Thank you very much.
You doing okay?
Doing fine. Doing fine.
Okay, I'm glad to see you remember to clean your equipment first. So that's a very important step. Okay, now you ready? Remember to locate the apex of the heart.
Okay.
Okay.
I'm going to locate the space between the 5th and 6th rib. Like this. And then I'm going to move my fingers to the mid-clavicular line.
Right.
And that's where I place my diaphragm.
Exactly. Now, do you hear the heartbeat? The lub dub?
I hear it.
Now you can start counting for a full minute. Now count for 1 full minute.
All done. 82 beats per minute. That's within the safe range for Mr. Allen's medication.
Now you want to record the reading in his records and make sure to note that it was an apical rate.
Right.
Okay.
Okay. Great.
Okay,
Thank
there you go. Thank you. Here's your paper.
Thank you.
Bye-bye.
Bye-bye.
Thank you.
Hey, Mark.
Goodness.
Still look tired.
Oh, yeah. I think the yawn is the bookmark of the day.
You're right. I think I don't know anything about it.
So, bravo. You all did a pretty good job today. Good work.
Thank you.
Now, before we finish up for the day, are there any questions or anything you'd like to review related to vital signs?
I had a question.
Okay, what's that, Melissa?
Well, when I was taking my patient's blood pressure, I had a really tough time hearing anything. I don't know.
Okay, see, that happens sometimes. Now, if you find this is a problem, you could try, try making sure the room is quiet. And check your equipment and connections. Check your stethoscope for the correct positioning of the head if it's a dual head, so the sound is being conducted through the bell or diaphragm. Well, depending on the site you're using, of course. Let's see. Yeah, recheck the location of the brachial artery and make sure you have the head of the stethoscope directly over the pulse site. Now apply a little firmer pressure to the stethoscope just to be sure that there's a good seal between the stethoscope and the skin. And let's see, now if you're still having trouble, you might want to try another limb if that's possible. You should practice blood pressure measurement often in a quiet room to become more comfortable with it.
I'll keep practicing.
Good. Now, sometimes there are other situations you'll have to make special accommodations for. You see, earlier Mark worked with a patient who had a right modified radical mastectomy and had a PICC line in her antecubital fossa. Mark, tell me something. How can you go about measuring her blood pressure?
Well, you can't take her BP on her right arm because of the mastectomy.
That's right, because, see, there's an increased risk of lymphedema.
And you shouldn't use her left arm because the PICC line is inserted there. Pressure from the cuff could damage the catheter or injure the surrounding tissue.
And so what would be the best site?
I guess the best blood pressure site would be her thigh.
Good. And Melissa, what's the procedure for taking a blood pressure on the thigh?
Place the stethoscope behind the patient's knee using the popliteal pulse.
Right, and just keep in mind that systolic readings in lower extremities are about 10 to 40 millimeters higher than the brachial sites, but diastolic pressure is about the same at either. How about the situation? While you're trying to measure the respiratory rate for a patient and you're not able to see their chest rise and fall, what would you do to correct this? Come on, anybody?
Melissa? Katie?
Go ahead, Mark.
Okay, that's okay. It's sort of a tricky question. Now, the way to handle the situation is put the stethoscope on the apical site and watch the chest rise and fall at the sternal notch, or you can just focus on the rise and fall of your hand on the stethoscope. Okay, any more questions?
No, I don't think so.
Well,
Not
then
for
I
me.
guess that's it for the day. And again, you all did a really good job, and you're off to a great start.
Thank you.
Thank you very
Okay, you
much.
should take this evening to review the skills that you were able to perform today, and have a good night.
All right.
We'll
Thank
see you
you.
tomorrow.
Thank you.
Thanks a lot. Oh. Thank you.